Thanks for joining us. This is North Coast Perspectives. I'm James Faulk. One step forward, one step back. As of this moment, Humboldt County has had a total of 181 cases of COVID-19 coronavirus, of which 35 remain active. Compared to the worst hit parts of the state and country, those are decent numbers, even if they've been inching ever higher. Yet the community this week is frustrated over a recent state decision to restrict again the operation of some businesses and organizations who've been determined to pose too great a risk. Movie theaters, bars, hair salons, museums, these entities, among others, are again prohibited as the state deals with skyrocketing COVID numbers. In many counties, the reset restrictions are even more severe, forcing some areas into near lockdown status, and it's not just in California. Further north in Washington state, the infection story is much the same. Florida, Texas, Arizona, even worse. Yet here in the northwestern corner of California, we've only seen incrementally increasing case numbers. Our luck, you might say, has been good. It's hard to savor good fortune, though, when we witness the sad and steady parade of beloved businesses and nonprofits teetering on the edge of oblivion. Redwood Acres, Scrap Humboldt, and this week the Discovery Museum. They cry for help in the hopes that they can raise enough cash to stave off having to fold up operations. By all means, please do what you can to save those valued community groups. If ever there was a need for you to give and give deep, this is it. Yet as we struggle on in our battle of attrition against COVID-19, it's plain that for most of us, the struggle is just beginning. One step forward, one step back. Now, the interview. Thanks to the magic of Zoom, we are joined today by Eureka City Councilwoman Kim Bergel. She's agreed to help us understand, in light of COVID, the city's current budget situation, among other things. Hello, Kim. How are you?
Hey, I'm great. How are you?
Good, good. Thanks for joining us.
Sure.
So let's start with the finances. The city, because of COVID, is obviously facing some budgetary issues. Can you describe what that looks like and what the city is trying to do to address that?
Well, we've had cuts across the board. All departments have taken cuts as we move forward. There have been no layoffs, which we are very, very grateful for. Although, you know, mid-year that could change. We don't really have a forecast for what our future is going to look like.
Yeah. What's the size are we talking about? How much money is the city needing in order to get flush?
That's a very good question. Can I just say a lot?
No, I hear that. Figures that most people would be strangers to. Now, I know that there's a sales tax extension in the works, potentially. There's a tax on the books now that's going to eventually expire, and the city may explore redoing that. Is that right?
Yes. Mm-hmm. Yes.
Go ahead.
I was going to say that, yes, the Measure O, which supported police and fire, will be sunsetting in April, and that's 0.5%. Mm-hmm. This tax is additional. And it will also go towards police and fire, and then also infrastructure, and those kinds of needs. Yeah, we came really close with Measure I two elections ago, but I didn't quite make it.
Now, if you've had budget cuts across the board, what have any services been impacted, and if they have, which ones and how deep, or is it something that you're hoping to avoid?
You know, I have to say that I am just so proud of our staff and our departments. They have worked really hard together to kind of level out the playing field, if you will, for the cuts. They've been working together as a team to make sure that, like, the most important things are staying implemented. And we have so many great things happening in our city. So that was going to be really, really critical to maintaining these services that we've created.
How is the morale among city staff?
From what I see and from whom I've talked to, it feels like people are pretty happy. Like I said, I think that we in our city are very fortunate to have such a great staff and a dedicated staff, including department heads, that really want to see a better future for our city, and they're willing to do what it takes to make that happen. And that was seen in the budget process in the way that they interacted and worked together to make sure that cuts were fair.
Absolutely.
It wasn't a money grubbing thing.
That's good. That's good.
Yeah.
Now you guys have a new city manager. An
interim city manager.
Interim city manager, yes. We
Yes.
had him on the show, and he said that he would like to make that a permanent position if he gets the opportunity. What are you looking for someone in that position?
Well, we want somebody that is forward thinking, that takes action, that has great leadership skills, that gets along with people, you know, all those things, and that has great leadership and treats people with respect and dignity. That's a big important piece of the whole thing. Yeah. But certainly somebody with good energy that's going to move our city forward, especially in times like these.
Yeah. Speaking of times like these.
And as you've seen, I'm sorry, I was going to say, and as you've seen, if you've met Miles Slatter, you know that he definitely has that energy to put forward and move our city in a good direction.
Absolutely. He was great on the show and he was amazing, really enthusiastic for sure.
Yes.
And competent
yes.
seeming.
Yes.
So, mentioning the trials that the city's going through right now, I mean, what are you hearing from your constituents about their concerns with COVID? Are people reaching out to you because they're nervous for the future? I mean, what are you hearing?
So I have had business owners contact me about, you know, the loans and what they can do, what they need to do for their business to get it reopened, those kinds of situations. And then I've heard from people who are just annoyed that they have to wear masks, which frankly blows my mind. But there are people that are just very upset that their rights are being violated through having to wear masks and that type of thing. And the social distancing is problematic for some people, which, you know, I guess to each his own.
How do you handle that as a councilwoman? I mean, for me or someone, John Q. Public, someone says something like that, you can, you know, say what you really feel. But as a councilwoman, how difficult is that?
You know, I don't believe it's difficult at all because, you know, the reason that we're doing this is that we're all in this together. And for me, frankly, and I would be willing to tell anyone this, whether you believe that there is a pandemic or you don't, isn't the issue. The issue is that we are in this together, and to slow the spread or not slow the spread, to make people feel comfortable, to be considerate of our friends and our neighbors. It's important currently to do what is being asked. And I don't think that it's that big of a I mean, frankly, I don't like wearing a mask either, but I do, because it's critical for us to move forward in our community. And we've got to just work together on this.
Absolutely. You're a mother, and the summer is coming to a close. Are you concerned about sending your kids to school come late August, or how are you feeling about that?
Yes, I am. Actually, I think my kids are they go to school at Redwood Coast Montessori, so they will be able to still do distance learning. I work at Eureka High, and so it's going to be an interesting process moving forward.
Yeah,
to say the least.
I'm sorry, my son also goes to Eureka High, and we received word today, we got a call from the district saying that Humboldt County is free to move ahead on the Plan B scenario, which is a hybrid between you know, distance learning and actual some in-class you know, attendance. So it's going to be interesting to see how that goes moving forward. We have a minute left, and I wanted to ask you about the you know, police reform. Basically, over the last few months, we've had a lot of unrest. The Black Lives Matter movement has been brought to the fore due to some tragic deaths at the hands of police. What are your thoughts on that? How well do you think the city of Eureka is doing in that regard, and do you see the need to call for any changes?
Well, I really, I feel like our police department addressed these issues and is still continuing to address these issues for the last, I don't know, 5 or 6 years at least. You know, currently we have the CSET team that works with a lot of the population, the marginalized population, and they truly do a fabulous job. And I know that the people, many that I've talked to, are really concerned about allocating that money towards social services. And frankly, that we don't have social services in Eureka, the city. That's a county thing. But I really am grateful and proud of our police department for coming up with something the CSET team and the city of Eureka with the Uplift program to find ways to support these folks that need the support that they need. And our police department has been doing racial equity training for at least 4 or 5 years now. So that's one of the things about our city that I really appreciate, is that we certainly are proactive in our behaviors. And I think that's going to take us a long way.
Excellent. I don't mean to cut you short, but that's all our time for this evening. Thank you for beaming in, and have a great weekend.
You too, James. Take good care.
You too.
Bye-bye.
As many of our viewers are aware, years ago I struggled with addiction and found myself desperate to get help. At the time, with no insurance, no bulging bank accounts, and no criminal referral, I had exactly 0 options for getting the kind of help I needed to get and stay clean. John McManus and Dr. Ruby Bayan of Waterfront Recovery have worked in the intervening years to close that treatment gap and make sure that anyone who wants to work hard and get clean has a place they can go to find help. This is the first part of an ongoing profile on the dream they shared.
I think the only treatment program that runs close to what we're doing is maybe in Southern California. I know some for-profits do, but not with a full-time addiction psychiatrist, not with a full-time nurse practitioner, not with full-time registered nurses and things like that. We are pushing the limits of our certification and the upward region, not going for bare minimum.
I also built programs at Kaiser Permanente for their addiction, mental health, and social medicine. And so I did that for at least 20 years. And so when I came here, I came here after retirement from Kaiser, being bored, and so the first assignment was here, and I went to mental health. And I was hired by them, but I wanted to develop an addiction program.
Well, this is more sophisticated than anything else that's been in the area ever, really. St. Joe's had a 6-bed, I believe, hospitalization program, but unfortunately it went away, and it wasn't, you know.
When they changed the administration, because I was asked to do addiction at St. Joseph with Dr. Soper, but then since the change of administration.
They had low-level services, treatment hadn't changed in a long time. Derivative of like 12-step programs, and that's how things worked. And 12 steps are amazing, absolutely, but as far as treatment programs, it's not enough. And like as a taxpayer, we take taxpayer money. We want to be able to provide the highest level of services, the appropriate level of services, to make sure that tax money is spent appropriately. And I feel like it just wasn't before. It was old, it was outdated. You're throwing a tiny amount of money expecting to fix one of society's biggest problems, but you're not bringing any skilled professionals, eyes to bear on this issue. There's a whole bunch of needs, but what we wanted was a one-stop shop to be able to provide the strongest foundation possible to set people down into lower levels of the continuum of care. That is our goal.
Tune in next week for part 2 of our ongoing profile. The Discovery Museum, a 25-year stalwart of the Humboldt County nonprofit scene and beneficiary of the annual Perilous Plunge fundraising event, issued a cry for help this week. The closures required to fight COVID-19 have hit the museum especially hard. Its entire purpose is to engage kids in life and science by giving them hands-on experience, emphasis on the hands.
So one of the big safety things with COVID is to make sure you're sanitizing high touch points, as a lot of us have heard about those touch points. So whether that's a door handle or a surface. And so when you are in the business of all high touch points, that's what we want children to do. We want them learning for that hands-on experience, that interactive, immersive experience. Everything in our museum is, you take groceries out of the shelves and put them in your cart. You take your cart over to the conveyor, and the kids use, cash registers and things where it's all high touch points. It's fantastic. It's wonderful. It's mastering life skills. It's getting kids prepared to go out in the world and embrace education and have this lifelong love of learning. And, we have a marvelous water table where, the kids have their hands in water and they're learning about, different species of maybe model animals that we put in there, and we can talk about density. And all of those things involve your hands. We're in a shared space. We're a big open space where families gather, the community gathers. We have play groups, we do story time. We bring families together. You watch parents support each other and have these amazing conversations and get together. And gatherings is what we're all about. Gatherings and hands-on. This is not the time.
Hamaker said the museum was able to get some federal loan support, which has enabled them to last this long. Absent significant help from the community, however, their days may well be numbered.
So we were able to do a PPP loan. Big shout out to AEDC who walked us through that and was super helpful. That will not get us through this, and it's not getting us through at this point. That's why it's July and we're having this conversation instead of April and having this conversation, quite frankly. That did allow us to have some of that breathing space to see, and to look and see what was going to happen. We really need the community support right now, or we really won't be here at the end of the pandemic.
The ongoing fight against COVID has underlined the importance of the Discovery Museum, Hamaker said. It's meant to inspire children to love science and learning, two passions that have proven pivotal in this moment.
Science is crucial, and education is crucial, and that is what we do. And a way to raise a world of children who do things like go into science and healthcare and taking care of communities is to spark a lifelong love of learning with them. You don't study medicine without having to learn. That's a lot of learning. And that starts at a really young age. And so what we do here is set children up to become healthy parts of the community and strengthen that. And while we're going through this, our children are amazing and resilient and wonderful and adapting, but it doesn't mean that it's easy on them. And when we come out of this, we are going to need those places where they feel like they're coming home, those recognized places. And we've been a consistent part of the community for 25 years, and we want to be for another 25.
To learn more or make a donation, you can visit discovery-museum.org. Humboldt County Health Officer Teresa Frankovich this week explained why Governor Gavin Newsom has chosen to reinstate restrictions on some activities and how those moves will impact the North Coast.
I recognize this is a surprise for us locally and a disappointment certainly on the part of many. Locally, we're actually doing fairly well right now. Our numbers look pretty good. We are not on the county monitoring list, which is a good thing because it would have been a more extensive step by the state had we been. But I think essentially from the state perspective, they are looking at the sheer numbers of cases that are being seen in California right now, the rapid increase in those cases, the increase in hospitalizations and ICU. And one of the other drivers of this is the positivity rate in testing in general for the state, which 8% is considered sort of a threshold or worrisome level, and we've been approaching that number quickly. So I think, quite honestly, I think that this is a measurement, an intermediate measure that's meant to help prevent us from getting to a place where we have to do a completely restricted back to full shelter in place mode. And so, and I think essentially our counties are being asked to participate in that effort. Basically the rule of this order is that food and alcohol must be done as a single transaction. So it is not the intent of this that people are going and drinking and then somewhere in there, ordering some food It really is meant to be essentially a meal with a beverage that is authorized. The other pieces of this that are moved to the outdoor segment are, again, restaurants, as well as wineries and tasting rooms, movie theaters, so drive-in theaters only would be allowed under this, family entertainment centers. Those included things like bowling, which of course is not going to be an outdoor sport, putt-putt golf would be allowed in this instance. And again, movie theaters had sort of loosely fallen in that category, and they would not work unless they're outdoors. Zoos and museums, their outdoor attractions are able to be open, but not indoor, and then card rooms.
Deputy Public Health Officer Josh Ennis this week unveiled a new tool offered by the county to help the public and others monitor our local outbreak in real time. A new color-coded alert system tracks a number of variables related to the pandemic, as well as our response, and links them into an easy-to-understand rating system.
Yeah, so this tool has been in development for several weeks, even a couple months at the very beginning. We were starting to look at various sectors related to the response. And from the beginning, we've been saying that looking only exclusively in the hospitals is a far too late place to look, that we really need to know what's happening in the community. And so this alert level system breaks it down into 3 separate areas. One I think we're all familiar with, and that's disease situation. So there's no shortage of information available online in regards to the spread of disease. And so this is looking at things like how many new cases there are, surveillance systems that look for popping up above normal numbers of disease, such as COVID-19. But it also includes other things in our alert level system that maybe we haven't paid as close attention to because they're further down the line as part of the epidemic. And that's the healthcare system. So do we have critical resources in place, such as the beds, the ventilators, the healthcare workers? We've been saying all along that the healthcare workforce is an absolutely critical piece that we need to maintain to be able to manage a true surge of patients. And then lastly, the third category is disease control. I think everyone's familiar with case investigation, tracing. We try and follow all the contacts of any newly identified case, but looking much more closely at our ability to perform that well and to make sure that we are testing enough people to have a good sense of what's going on in the community and that we're capable of adequately containing the cases that we identify.
In order to see the new rating system, you can visit HumboldtGov.org. In addition to simply keeping the public better informed, Ennis said the alert system will be useful for decision makers as they set policy and plan for future activities.
The idea here is to allow a peek into some of the things that we consider to be important that can ultimately shape policy. And so to make it a little more concrete, there could be decisions made, such as closing another particular sector if there's a concerning trend in some area. It could concern other measures, such as activities surrounding kids in school. We haven't necessarily tied any one of these actions to a particular alert level. And so it's really important to point out that this is a work in progress, much like the dashboard, but it's building upon the dashboard and trying to build much more of a foundation to make decisions that are based in data and that are specific to local conditions on the ground.
We'll be back in 1 minute.
Our country is home to millions of people. Each one of us is unique, and we're all part of the American story.
Pbs American Portrait is a national storytelling project that asks you to submit your individual stories.
Through short videos, photos, the written word, and artwork, you can respond to one of a number of thought-provoking prompts.
This is our opportunity to add our rural voice to the story.
Whether you share joy or sorrow, triumph or hardship, Whether your family is new to this region or your family has lived here forever, your story is important.
For a full list of prompt questions and instructions for submitting your story, go to pbs.org/American Portrait.
The staff at KEET TV can help you record your story.
Please take a moment to submit your story to PBS American Portrait today. Thank you.
This is North Coast Perspectives. I'm James Faulk. Eureka Mayor Susan Seaman this week addressed the frustration felt by many at newly reinstated state restrictions. It's hard on people, businesses, and other organizations, she said, and it reinforces the importance of keeping your distance and washing your hands.
The City of Eureka is continuing to work strenuously to support the health and well-being of our citizens, our community, and our economy during this COVID-19 pandemic. Beginning today, the guidelines to allow several types of businesses, such as restaurants, bars, movie theaters, and family entertainment centers, have been rescinded or modified as COVID-19 cases continue to increase. Please visit humboldtgov.org to find the most up-to-date guidance on which businesses are currently allowed to remain open. Zoos like ours in Eureka are on the list to close their indoor activities, but there's still access to the outdoor area with a great deal of care and effort going into the safety of our visitors. During the shelter-in-place order, the zoo is limiting entrance and reservations are required. We understand that kids still need to get out, stretch their legs, enjoy the sun, and explore a little. This is a great place to do that. Make your reservations at sequoiaparkzoo.net. If you want to support the zoo but you're not ready to visit in person, that's okay. There will be a virtual Zoutini fundraiser on August 8th where you can celebrate animals in conservation from the safety of your own home. The zoo has an exciting year planned. As one of their largest fundraisers, Zoutini has played a key role in seeing many new improvements come to fruition, like the forthcoming Skywalk. You can find out more information about what's new at the zoo or how to participate in Zoutini at sequoiaparkzoo.net. We're lucky that we have several organizations that help make Eureka an enriching community for families, but unfortunately many of them are struggling right now. This week, the Redwood Discovery Museum sent out a letter to the public seeking donations to help sustain them while the museum is closed. You can donate or learn more at discovery-museum.org. The Redwood Discovery Museum is just one of many organizations that's lost their traditional sources of revenue and fundraising. As we come out of COVID-19, family resiliency is going to be important for our community strength, and we'll need to work together to make sure children in our community continue to have access to educational and enriching activities. If there's an organization that's been important...
Thanks for joining us tonight. Remember to keep your distance, wear a mask, wash your hands, and stay healthy. Otherwise, stay tuned, stay informed.